everyone, my name is Dr. Komal. One of the frequently asked questions when a couple undergoes an IVF cycle is what would be the success rate, whether can IVF guarantee a pregnancy or assure a pregnancy. Is it just the center, is it just the doctor, is it just the climate or the month in which the patient goes IVF cycle that determines the success rate? So to answer this question, there's a simple 5 important points which I would like to convey. So the first most important factor is the age of the woman. So as the age of the woman increases, the oocyte quality reduces and the oocyte quantity also reduces. Also, there is higher risk of miscarriages and lesser implantation rates. So age is definitely the single most reliable fact when it comes to IVF success. The second common factor is the most important factor is the ovarian reserve. Now what is ovarian reserve? It is the capacity of the ovaries to produce fertilizable oocytes. Now this ovarian reserve definitely goes down with the age, but there are other conditions where the ovarian reserve can go down, like if there is previous history of moms, exposure to chemotherapy, radiotherapy, endometriosis. So all these conditions can also affect the ovarian reserve. Nowadays we see many women in the younger age, even in their 30s, who have low ovarian reserve. So this is another important factor. The third important factor is the sperm parameters, the sperm factor. So we all know that count, motility and morphology of the sperms are important, but even more important is the sperm DNA integrity. So what we assess by measuring the DNA fragmentation index. So this can get affected by various factors like paternal age, even infections of the genital tract, or varicocele, or chronic conditions like diabetes, cancer, etc. Then coming to the fourth important factor, that is the embryo quality. Now this is a very important factor which affects the IVF success. Morphologic assessment of the ovary is normally done, conventionally done. So usually the top grade embryos usually give a good IVF success rate as compared to the moderate or poor embryo quality transfers. When you consider day 5 embryo transfers, give a better success rate as compared to day 3 embryo transfers, and fresh frozen embryo transfer cycles where the embryos are frozen and thawed. Such cycles give a higher success rate as compared to fresh cycles, especially in hyperresponders like PCOS, or when patients have to undergo genetic testing of the embryos, or when there is an endometrial pathology like high progesterone values or endometrial polyps, etc. Then the last important factor is the implantation. So implantation is the rate limiting step when it comes to IVF. So where during implantation a lot of chemical and biological changes that take place at the microscopic level at the endometrium. So it's very important to get improve the implantation rates by proper development of the endometrial thickness, standard techniques for embryo transfer, and by better assessment of the implantation potentials, probably by doing ERA in patients who have had recurrent IVF failures. Nowadays we have advances to assess the embryo quality apart from the conventional morphological methods, that is by using time-lapse imaging and by the use of artificial intelligence. Thank you.